So, hello everyone. So I'm just going to run through taking a blood test from a patient now. I've got my standard patient here.
Hello.
Hello, James as always, and I've got Tina behind the camera for moral support.
Hello.
So I have prepared my tray just like we have done in the previous video. So that's all prepared and ready, and I've brought with me all my ways of identifying the patient. So what I'll do now is I'll introduce my patient and I'll make sure I identify them correctly. So, hello, my name's Tom, I'm a nurse, I'm here to take a blood sample.
Hello.
Hello. Is that okay if I do that?
That's fine.
Have you had one done before?
I have.
Okay, brilliant. Before we get started, can I just take your name and date of birth, please?
Yeah, my name is SimDemo1 and my date of birth is the 1st of January 1968.
Okay, brilliant. So I can then check that name and date of birth on the computer, so SimDemo1, 1st January 1968. But because I'm taking a blood transfusion sample as well, I need to check that information on this paper form. So SimDemo1, 1st January 1968. That's brilliant. So a verbal check isn't enough, we need to do a visual check as well. So for standard blood tests, the visual check is going to be using the scanner, so scanning the wristband, and then we can see that the samples that we need have come up, and we need to take a red bottle and a brown bottle, one for haematology, one for biochemistry. But I am going to take a blue bottle as well for blood transfusion samples, so I need to visually check this form on the patient's wristband. So SimDemo1, date of birth is the 1st January 1968, and the MRN or the hospital number is 2016375. So this form matches this patient, and this computer matches this patient, so I'm all happy to go ahead and take a blood sample. I then need to try and get the patient in a good, comfortable position. So are you in a comfortable position?
I am.
Good. And then I need to make sure that I can access the vein here. So I've made sure I've got a pillow underneath the patient, their arm is outstretched, and I can access the bit that I want to. I'll also check with the patient that I can actually use this arm. So is there any reason why I can't use this arm?
No.
So I want to make sure that there isn't any reasons like fistulas or lymph node clearance or anything like that that's going to interfere with my blood sample, and also make sure there's no cannulas with any infusions running. I can then have a little look at my veins visually just to see if I can feel any veins, and I can see there's some good potential there, but I will put my tourniquet around the patient's arm to see what comes up. So I'll wrap that round there now, and I'll see if there are any veins that have come up. And I can see here that this vein looks really good. I'll look away, I'll have a good feel. It feels really good compared to the other ones. So this is the vein that I'm going to, and I know where I'm going to be sticking my needle. Now I can release my tourniquet now to give the patient some relief from the pressure of that. And I can now begin to move further with the blood test. So I want to give my hands a good clean. I need to get my gloves on at this stage. Now, what I can do now is place my foot where I will need it. So I'm going to put my two bottles next to my patient, and then I can also put a bit of gauze next to the patient. I can also then actually as well clean the patient's skin, because I know I'm going to be sticking the needle with my alcohol, and that could be drying while I am getting the rest of my stuff together. I can then now wrap my tourniquet around the patient's arm because I am ready to go ahead. Sometimes it's a good idea just to do a little visual check or a run through when you get to this stage, just so you don't get lost in your actions. So I'm going to take my needle and my bottle. I'm going to make sure I hold it correctly between my forefinger and my thumb. I can then use my other fingers to steady myself. I'm going to make sure the bevel is up, so the whole of the needle is up and the point is going to be pointing down. And I'm going to use my other hand, my non-dominant hand, to stretch the skin and pull the skin tight so that anchors the vein steady. That is absolutely key to getting a needle into any vein, is making sure that you anchor the skin and perform what we call skin traction. I'm then going to warn the patient. I'm just going to insert the needle now, and I'm going to move the needle into the vein. The patient didn't feel anything. And then I'm going to slowly aspirate the blood out of the vein, holding the needle very carefully. I'm going to put it nice and slowly and allow the bottle to fill. and then I'll twist the bottle, I'll take that off, and then I need to connect my next bottle. So if I'm doing a brown, a red and a blue, if I think about my tree, the thing that comes after the trunk would be green leaves, then the fruit, so that's what I'm going to put on now. So I'm going to connect that bottle, and because I've pre-vacuumed, that automatically fills up. And then obviously the last bottle is the blue one. I'm going to connect that on, allow that to fill. And then what I need to do now is release my tourniquet. This can be a little bit tricky for some people because you want to be very careful not jog the needle, but if you just use one hand to take the tourniquet off, that can come out relatively easily. Get your gauze, place it over your needle, and then pull your needle out and then push down firmly on the patient's skin. Activate my safety device, drop my needle into my sharp, and then you can ask the patient to push onto the gauze for you. My first bottle, because I didn't click it while I was connected to the needle, I'm going to click it now and then snap the tail off. And now my bottles are ready. So by my bedside, I'm going to take my gloves off. I'm going to give my hands another clean, and I am going to say on this computer that I need to print out my labels. So print all labels. I'm going to select the printer that I want to use, and then I'm going to press print. And my labels will print out. I'm then going to say that I collected each bottle that I've collected, and sign to say I've collected them. I can then label these bottles at the bedside with the correct label. So a brown label for the brown bottle, it's not brown colour, it says it's brown. And then the one that says red on the red bottle. And then for my blood transfusion sample, I'll need to hand write that bottle out, making sure that I sign and print on the actual paper form, and write the date and time that I took the bottle, and sign onto the bottle as well. Once I've done all that, I then place them all in the specimen bag. With my blood transfusion form, which is signed and printed and done all that. I can then say to my patient, is it you okay? Can I have a look at this, please? I can make sure that it's stopped bleeding, and I can say, just put your finger on that for me. I can then get my tape, find the end, which is quite a challenge sometimes. Cover, put tape over this so it stays in place. And then we're all done. Thank them very much. Thank you.
Thank you.
And high five on the way out the room.